Initially, what began to happen is I was experiencing ED, erectile dysfunction. It was at the point that I couldn't maintain an erection, and we spent 5 years literally researching, trying to find an answer. After we found on the internet that the symptoms that I was having was related to Peyronie's, I finally saw a urologist who said that he was not an expert in ED, but he recommended that I call someone by the name of Dr. Jones.
Well, when a patient first presents with Peyronie's, we actually like to see him right away. I mean, typically what happens is that the guy will notice some curvature, or his partner, and they're not really sure what's going on. And so we'll start out typically with oral therapy, and then depending on how the patient is doing, we may continue with that. If it's progressing or getting worse, then we'll do what's called intralesional therapy, and that's actually injection therapy. And then if that's not effective, then there's surgery, and there's some corrective surgery to straighten it out. And then lastly, penile prosthesis. So a lot of it just really depends on how bad the curvature is and when the patient gets to us.
So Dr. Jones confirmed my situation, and what was so encouraging, he says, the problem that you have, you're not going to be able to fix yourself. But he says, I have a solution, and that solution was a penile implant.
He had his implant, and he did very well with it. So he's not from San Antonio. Drove in, had a surgery, still outpatient operation, stayed in a hotel, saw him back the next day, and went home, and he came back in 6 weeks, and we taught him how to use it, and with our staff, and it's changed his life. I mean, it's a different person, and the thing about implants is that most guys that get them, they always regret waiting.
After I had the procedure done, the results were really far exceeded any expectation that I have. So now my wife and I still have the emotional tie. Now we have that physical part of our life back that we enjoy.